This cyber incident and this breach has now been going on for quite a good chunk of the day, and people have been out of power for a significant amount of time. While we have previously looked at the potential of how this attack may have happened, we've also looked at the communications plan and how this needs to be escalated and moved both internally and externally, and also weighed out the potential of declaring this as an emergency. We're now going to shift gears a little bit and look at the direct impact that certain critical sectors are facing. At this point of time, there are multiple questions on our mind, and I'm joined by leaders from across Canada and North America who will be discussing their perspective on action items we need to take at this point to limit the negative impact on emergency services and healthcare. There's two components to it. There is a security and a technical component, but there's also the continuity and the business continuity and the need for services to be run seamlessly while we navigate this power outage. I'm joined by Martin and Greg, who are going to be my co-hosts. I'm going to start off with Greg and ask him just to give us in a quick minute, right now, Greg, from your perspective and your leadership, what is one of the most important action items that we need to be looking at?
Yeah, absolutely. You framed it perfectly there. There's the impact to healthcare, and then there's the triaging of the cyber side of things, right? And typically when healthcare faces a cyber incident, it gets full attention and support from everyone involved. This would be completely different. Hospitals and everyone else are focused on maintaining services and keeping that healthcare standard high. Cyber is going to have to do the opposite of what it would and just go into a bubble and work as autonomously and independently as possible and achieve everything possible on its own without that broader support net. So it's going to be rough, right? Networks would be down, comms would be down. How many of our tool sets are in the cloud now? Those could be down as well over time. So as with chaos, it's just going to be a matter of prioritize, triage, and put out the biggest fire as easy as you can, but understanding it's going to be a difficult go.
Yeah, I think the allocation of services and distribution of resources is going to be critical, and given that healthcare is not the only center that's hit, prioritization is going to be top of our minds. Martin, from your perspective, same question.
Thank you, Ali. So for me, I think it's very important to understand the context of healthcare across Canada. We have to understand that there are approximately 2,000 long-term care facilities, about 1,300 hospitals, and about 300 community health centers. All of these organizations have been working independently for the last 5 hours, wanting messaging, wanting an understanding of the situation, and I could probably bet some of them have already made certain decisions in terms of how to act. The next piece of priority for me would be to understand the current state with respect to backup power. The vast majority of these hospitals and healthcare organizations have approximately 96 hours of backup, and that, according to that clock, they're down about 20%, because that's a countdown clock to me from 96 and slowly ticking. Now, keep in mind the difference between rural, urban, and suburban healthcare. The rural areas of Ontario and of Canada are probably running closer to 24 hours. So current state assessment, where is everybody at across the nation, and what do we need to do to make sure that the triaging of patients, as well as potentially transfers of patients across various healthcare organizations, starts to materialize if backup power starts to go. Thank you, Ali.
Yeah, the equity of service and the equity of the response, not something that we brought up previously, but again, we'll add this to our roster of action items. And I think you raise a very, very important point that it's not a one-size-fits-all set of action items we need to get into. I'm going to, just for the sake of those who are watching online as well, and especially if you've just been tuning in, we do have a quick news report that we can share, just giving you a little bit of a summary about how emergency services and healthcare are getting impacted. I'll see if I can try and bring that up for you live at this moment while I look at some of the other notes that I have received as well pertaining to this event. We should have that video popping up.
Good evening, and welcome to our special coverage on the aftermath of a cyber breach causing a widespread blackout across the nation.
This just in. A national blackout is wreaking havoc on our health services, plunging hospitals and medical facilities into darkness. With power outages disrupting critical equipment and systems, patients are left vulnerable and medical staff is working tirelessly to ensure their safety. From life-saving surgeries to essential treatments, the blackout is pushing our healthcare system to its limits. The Chief Information Security Officer was quoted as saying, "Our cybersecurity measures are being tested
across sector right now, and especially with the backup powers coming to a bit of a potential conclusion, there's going to need to be some effective action taken soon. If I can start off with Bill, from your perspective, looking at this attack and what's transpired over the last little while, would you say that the emergency services and healthcare, if we can just speak broadly right now, would you say that both these sectors need to be on alert for a potential escalation of this attack into their environments as well?
Yes, in a broad term, but I think you all highlighted some of the main points, like the prioritization as well as the focus. So I think Greg mentioned going to a bubble for cybersecurity, like kind of the division of responsibilities, like leaning on some of the local authorities to help with the broader communication, so that the people taking care of the cybersecurity thing can actually ideally isolate some of these environments, start digging in so that we can get to what is known, what's unknown, as well as kind of parallel track of where are we as far as being able to restore these things. Do they have backups? Do they have isolated environment they can put that back in? What are the options? And that's kind of the first stop.
Yeah, speaking on this point, we did receive a little bit of more intelligence and some details that will come up live on the screen shortly in terms of the reconnaissance. So we are getting confirmation that this is definitely some form of a cyber attack that has hit. Give it a moment. Sure. Yep. It should be coming up right now. You can see the reconnaissance report that has come up, and I'll just go through a couple of the most important points. The first thing that has been suggested as one of the mechanisms by which the utility center was hit is actually a drone-related surveillance. And it seems quite interesting that this was used primarily because they would have to have routed those drones in order to have gone nearby Northern Heritage Power Generation. There's talks of social engineering that may have been used specifically around how details around what systems they were using at the power generation facility, how those were found out. What was interesting is in one of these notes I see that it suggested that some job descriptions may have been studied for them to understand what tools that they were using at the center. And there's also a lot of discussion around how, through social engineering, some controls may have been evaded. So, Bill, based on what you've said, Chris, if I can bring you into the conversation at this point, the nature of this attack, what do you see from the reconnaissance as well and what we heard in previous sessions? How mature and how advanced does it appear to you, and what would be of top concern right now from your perspective?
From what I'm seeing, and essentially the vectors that we're looking at different types of reconnaissance that has been used throughout this incident. We want to be able to extract the actual indicators of compromise from any of those accounts that may have been targeted, the timings that these drone surveillance may have passed over, looking at these IoT devices, how many of those have been targeted, where have they been targeted from, and pulling those accounts that may have been also targeted, and kind of basically setting up an incident coordination here and looking at, on a broad scope, what we have access to actually take actions on, and actually look throughout the networks that we can then leverage to gain visibility into what may have been additionally impacted. Because we will only be able to contain the situation based on the visibility that we do have throughout the network.
Agreed.
If we don't have that visibility,
yep,
and we attempt to bring services back up, systems back up, then we're going to be increased,
yep,
with risks in terms of an actual additional attack that may occur.
Chris, going back to Module 1, Mark had brought that up as well. I mean, bringing all the lessons learned, that visibility and a complete set of all the assets that are in operation, whether in-house or off, whatever it may be, that would be necessary at this point, and visibility into it. And this is something that these sectors, the emergency services and healthcare, will probably want to look into. I'm going to go to Kajivan very shortly about the status right now at a healthcare facility. But Rhonda, coming in, if I can loop you in from your municipal perspective, as you're looking at this, there are hospitals in your municipality. There are services, emergency services that you might be overseeing as well. What's going through your action items right now based on what Bill has said, Chris has said, and what we're seeing as a fairly sophisticated attack that includes a very unique set of reconnaissance activities?
Yeah, thank you there. So a couple of things going through my mind. One is when we talk about how long the generators will be operating, I have to, as a municipal leader, think, wow, where's our evacuation center? And are we going to be set up and able to take on the hospital? So getting that prepped. Another thing that comes to mind when I see this on the detailed impact is the SCADA sensors. So making sure that we keep an eye on that. So SCADA manages the water, so we want to ensure safe water for everyone. So having maybe manual testing done and ensuring that we also grab a crew that can go door to door in case the communication doesn't get to them in a different way. So those are a couple of things that come to mind right away.
Yeah, Rhonda, thank you for escalating this, because I think you are right that we are in a situation where lives can be impacted directly, depending on the nature of how this moves. So Rhonda, we'll hold on to that thought very shortly, and I'll go to my co-host. But Kajivan, this was a question that came up towards the end of our last session before we took a breather for lunch and took this all in. Kajivan, from a hospital perspective, from an action items, do you think now is the time to declare some state of emergency? How are you approaching that? And can you walk us through some steps you'd follow right now?
For sure. At least from our perspective, externally, declaring a state of emergency is outside of our control. But within our hospital, we would have opened up a priority 1 bridge, and we would have been discussing while we have power, for the next 96 hours or 72 hours, we will decide, what's our actions going to be if that outage is going to be longer than the 3 or 4 days that we have planned for. How do we prioritize, and what are the communication methods we are going to rely on once everybody's cell phone and the hospital powers is completely cut off?
Right.
Do we expect the full cyber team to be present at each hospital? All of those arrangements we want to make, as well as what do we do with our network? Do we shut it down and completely run in silos, or do we say, okay, well, until we have power, we will utilize everything that we have and the cloud security tools, cloud solutions, that Epic and everything else? How is that going to work? All of those things we would plan it out. And one more point for the IOCs, we would like to see if we can establish some form of communication with any of these places, whether it's through Ontario Health or other agencies, to understand what are the mechanisms, what are the systems that we should be shutting down. If they were the first initial compromise, for example, one of the thing that you mentioned, the IOC, is that reconnaissance was done for the Wi-Fi, for example.
Yeah.
So do we shut down our Wi-Fi because maybe that was the initial vector, and the emails down because that would be the next vector that might happen? And by looking at those drone capabilities, it's either terrorism related or a nation state related, because usually the other 3 steps are common across, but the drone is generally not very common when it comes for cyber attacks.
I like that. Martin, if I can come to you, and then Greg, we'll go to you, and Ali, I plan to come to you and Ian very shortly. Martin, from your perspective right now, could you even made a point in terms of, do we continue working with this environment that we have and backups for the next 96 hours? In the worst case scenario, if this goes beyond the timelines of our generators, what happens beyond that time period? And do we need to be speaking about that now, or is there another cutoff period at which you would suggest maybe a day or two into the outage?
So we have to, to Kajivan's point, some hospitals have 96, and as I said, some hospitals have 24. It depends where you are geographically. Now, by the time I mean, obviously, it could be a diesel generator, depending on the type of generator. What does the fuel situation on the supply chain look like for that generator, and how can you refill that generator to bring it back up to another, let's just say 96 hours or 72 hours, whatever that runway looks like. Those decisions need to be considered pretty much immediately, because by the time you're actually able to coordinate a response, coordinate communications to the service supplier, manage the procurement side, because this would be like an off-the-cuff kind of procurement, probably non-standard procurement,
right.
Excuse me. By the time all those decisions are made, you're at 96.
You're at 96 hours.
Easily.
I think this differentiation also between public sector and there are private clinics as well as one that we will probably want to get into. Greg, quick question on your side, looking at what we're dealing with right now, and I'm going to go to Ali next and then Ian. Greg, the equity of service and the situation in terms of rural hospitals and urban hospitals. What's your perspective on what are the priority areas there now, and how can resources be allocated sufficiently to both sides?
Yeah, it's an interesting point. It's a good point to make too, right? Like hospitals are a spider web of a community where if one is down or having an impact, ones around it will pick up the slack and help each other out, right? In a situation like this, you're not going to have that. Everyone's going to be, shin-capped and running on limited lifeline, right? So I think you're going to see a prioritization the same way that we're prioritizing cyber. It's going to be a prioritization of healthcare. Obviously, surgeries would be canceled. Obviously, the public would be asked to avoid hospitals unless they absolutely need to come in. And as you approach those later days and later times, right, some hospitals will be fully down, operating off paper. Communications will be cut, and they won't be able to help each other out, right? So as much as you can pursue equity of care and things like that, it's probably not going to be something that happens, and it's just going to be staying alive. That will only get worse with time.
Okay, so Ali and Ian, Ali, we'll start with you. Ian, we'll go to you next. Ali, one of the concerns we now have is, because you even alluded to it as well, is that while there's no eminent evidence that the healthcare services or emergency services have been hit, is there a concern that some of the data within the healthcare environments could be compromised? And what are some action items required over there to protect that environment?
Well, that's exactly might be the case, the reality in there. And one area that is concerning in such situation is related to the connectivity because most of the hospitals and basically service providers are using cloud services for their protection and controls that they have up there. And now everything is down. And now we are pretty much blind in the environment, and we need to know what type of capabilities we have from the local perspective all the way to the cloud perspective, that we had our controls in there, and how we are going to be able to have a telemetry in there in the environment. That's how we are going to have the visibility in what's going on inside our networks. Then if there is anything going on, we need to look into that containment right away, because the reality is that we don't want to have it spread across the board. And as Greg mentioned, in the spider web of the hospitals, because that's how usually the lateral movements are taking place and going into the... So those are the areas that we need to for sure consider, because the reality is that yes, they might be already in, and they might be already acting on something that we have no ideas about it.
Okay. Ian, this was something we have not yet touched, and that's the integrity of the environments, which also ties into the CIS controls against which we're trying to map our key takeaways from. Is there anything that you would recommend, both in the hospital space, in the healthcare space, and emergency services, to test the integrity of their environments at this moment?
Yeah, it's a great question. To test the integrity of the environment, it really depends on what's still operating at this point, right? That's the challenging thing. In a hospital, you're going to have to make that hard call, around what systems do you keep online, right? One of the first things you're going to do in this situation is say, what can I pare back, right? Because like the priority is going to be dialysis. The priority is going to be, systems like that are immediate life saving. So, in terms of integrity and making sure that the controls are good, having played out the scenario before, one of the things that I would be the most concerned about would be the internal networks in the hospitals. And I say this just because they are a soft spot, right? We mentioned the spider web effect of the hospitals, right? It's all, the way that we are built is all routing site to site, right? Over, be it private networks, MPLS clouds, there's a variety of things in hospitals. I'd be the most concerned about disruption to that part of the system, less so about the data itself. If I was an attacker and playing this out on the red team side of this, I'd go after the internal ability to route between sites. I would go attack your core switches and I would flatten those, right? And then you're not getting systems back anytime soon. So I'd be very concerned about protecting those and making sure the integrity of those is good and that I can roll back if something weird seems to be going on there.
Just to add to that, you're taking away resources if you are testing integrity just for sake of verifying or having a peace of mind. That wouldn't be the priority for at that time, because we want to make sure we have enough resources available to firefight rather than just verify to have a peace of mind. And we will probably allocate, it will be a rotating shift, even though most of us are 9 to 5, just because we have enough people to make the calls throughout the day. Okay. So those would be our priority as well. We wouldn't, unless we have reasons to believe we were compromised.
I think with the hospitals too, you'd have the regional SOCs. You would kick in the war room for the regional SOCs, right? And so resources would absolutely be involved in that. Mm-hmm. You'd have somebody on that bridge 24/7 rotating in and out.
Okay. I want to come to Bill, Chris, and then I'll go to Theodore, and then also we have a couple of questions for Rhonda and Lena as well. Bill, I'll start off with you. Is the hospital environment, obviously they're using some very critical applications that store PII, very important medical related information. The segmentations of the networks in this situation, how do you approach that at this point? Do you allow for certain applications to stay on? Do you go to a pen and paper like mechanism in light of the fact that you may end up going offline? How do you recommend preparing for this environment?
Well, I think just the key word, preparing. So a lot of this is what did you plan for ahead of time? What keeps coming to mind is when architecting for resiliency, we often use the concept of the control plane, the data plane. So what can operate, if something's interrupted, what can keep operating without some sort of intervention? So ideally, your preparation kind of takes that into play. So if your plan requires you to take action on the control plane to reroute something, point somewhere else, that's probably a bad plan. Yep. Can that thing operate? So going back to the idea of prioritization, critical functions, how many of those things can you set up so they can operate for a certain period of time before, so you have a chance to fix things? Kind of abstracting out to the physical world, the fuel delivery. How many is there a way to have standing orders so those fuel companies know power's out? I know I'm hitting these 3 hospitals first. That kind of thing. Yep. So.
Yeah. What is our kind of ability to look at the source of the actual intrusion or incident, and then our ability to kind of bring in backup and recovery abilities from additional sources. If Northern Horizons is our source and our compromise and our true location that was the disruption of the services and the power outage, what can they share with the hospitals and healthcare systems that they can use to look at their environment itself, what is still operational with that backup power, and say there's no indication that their incident has become our incident, even though the power connection is there. But if there's no connection between indicators of compromise or any of the data we've seen with the intrusion itself, then moving to the backups and then looking at additional sources of power for as long as it needs to happen should take place, in my opinion.
Just extracting a little bit from that, Theodore, I want to bring your perspective into this. Is one of the action items we're looking to take back in terms of how we're responding is our communications now with doctors. And of course, a lot of them rely on connected devices to perform some of the actions and surgeries that they have to do. From a prioritization perspective and a communications now to doctors, to surgeons, etc., what are some critical steps that we need to be considering so that they can prioritize what patients or which patients they want to handle first?
Well, I would say that we're going to look at the most critical procedures that need to continue and that need to happen. We would also look at other means of communication, depending if that line of communication was severed or was affected or could potentially be compromised. So if it means having perhaps our call center or another capability reach out to the doctor, or have the doctor reach in to get updates in a more manual fashion, or have that coordinated via an alternative means as opposed to the main systems.
Okay. Rhonda, you brought up this topic on emergency services and sort of mobilizing resources within the environment. Now, from your perspective and your municipal lens that you have, in terms of supplying more resources to support healthcare services and to support emergency services, which partners do you recommend we start talking to? Are there other municipal partners, provincial partners, federal partners? Do we have anything that, or any groups that we can reach out to scale services in our community and withstand some of the pressures that we might face should there be a prolonged outage?
Yeah, for sure. We have a list that we have compiled and most municipalities have as part of our emergency management operations. So we would, my first thoughts would be to reach out and make sure we're in close contact with the hospital and their team. At this point, I would anticipate that our mayor would have also declared a state of emergency for us, and we would be working forward with the hospital if we could reach out to, Red Cross and others that could offer volunteers, and they would manage the volunteers. We would also engage our the OPP and fire services just to be able to provide any resources that we can to help out. Again, I think, when there's an outage, a lot of it could be going door to door, especially if it's a prolonged outage, to make sure that our vulnerable population is able to get to a shelter depending on the weather, and be able to get, the water and things that they require. So we would sort of kick our emergency operations in gear and just offer any resources. And we do have a list. I named a few, but we do have a lengthy list of those that we would reach out to that would help in securing some of our volunteers, because through the municipalities we don't do that, but we'd reach out and we'd be on standby for whatever we could to help out.
Thank you for that, Rhonda. Lena, as I'm getting some more information, it'll be coming up onto your screen as well. One of the things that was taken away from Module 2 was the importance of classifying the type of communication. That will come up shortly on the screen. Initially, many of the events were seen as, they were minor and moderate, but now with emergency services, one of the things that's come up is we're getting reports of people stuck on elevators for a very long period of time, seniors that may be hit and need to get down from the 35th floor, etc. At this point, given the emergency nature of things, the life and death criticality as well, from your side of the fence, what resources or what assistance can you provide, if any, to help guide our response to what we're seeing now?
Right. So as we talked about earlier, you have your cyber response piece, which is sort of in the background, because the public safety piece will be the priority. So when you look at the public safety piece, it's exactly what Rhonda said. The bigger centers have access to fuel, have access to generators. A lot of smaller places are not. If people are at home with medical devices, they may not. If people can't access medications, people can't get around. So you have to appreciate that at any given time, our hospitals are running at capacity, our fire services, our police services, everybody's running at capacity. Right. You throw something like this into the picture, and now what you've done is you've backlogged all the stuff that was already running at a frantic pace, and now it's exponential, the level of response you'd need. So at that point, the best scenario would be if the impact is sort of restricted to Ontario for the most part, then the likelihood is going to other provinces, as long as, again, you're not pulling resources and then they suddenly have an attack in their backyard. So always having to balance those two pieces, but being able to build that capacity to bring in resources from other provinces, from other areas, other jurisdictions, to help support exactly those things. So you're helping, because again, you now have no working traffic lights, you have gridlock, so even if you were to bring in emergency services, how are you going to get them? The roads are blocked. So these are all the kind of things that you would have to think about, and this is where our cities and municipalities are going to be able to come in and, you know, they have heavy equipment. Are we going to be able to use it to clear certain roads, like thoroughfares? Like, those are all things that have to be thought of. If the goal is to maintain, you know, one hospital as an emergency site, or one that's sort of dealing with some significant issues that are caused by this, the goal is to ensure that people can even get there. So your ambulances, your fire, your police, how do you build that capability to ensure that you can move people around? And then as well as the personal security. I hate to say it, unfortunately, sometimes in times of crisis, people do terrible things. So how do you protect the general public from other people in the general public? So that's a priority. Is again, what are your sectors that might get hit? You might see looting and impact at banks. You might see impacts at I hate to say liquor stores. I've seen it with my own eyes. But you know, you have all these impacts at areas where people are going to go and try to steal things. And what that unfortunately does is now it's going to draw resources away from really critical, like healthcare sector, life and death. So as always, it's going to be a balancing act of where is the greatest likelihood of risk to the public, where is the greatest risks of death or serious bodily harm, and then addressing your resources around those to make sure that those are prioritized.
I want to just work on this point a little bit, and I'll come to this side of the table very quickly. But Bill and Chris, and I know this is a very direct question that I'm going to ask, but it's one that we need to, and it's one that I don't think gets asked a lot, is from your perspective, you know, coming your experience with AWS, your experience with CrowdStrike, and your awareness of these industries acutely, you're also being impacted by this power outage. From your side, whether it's an operational thing or a technical perspective, what are some of the action items you are doing internally to ensure the stability of your services and availability of it, as many of the people in this room will rely on it, at least from a cyber perspective? Bill or Chris, whoever wants to go.
I can start.
Yeah,
I mean,
sure.
AWS is primarily infrastructure like data centers and such, so that's core to what we do. So speaking of like fuel, power, we've got plans in place, test them continually, as well as having infrastructure beyond Canada if need be. So I'm very confident that we'd be able to last quite a while.
Okay. Good.
Yeah, and even from the CrowdStrike side of things, it's ability to not just rely on a soloed portion of our ability to respond to the incident. We do have people that are in different geographic areas, an abundance of consultants that can jump in at any single time. We do have that around the clock nature to our business, and whatever's asked of us in the capacity of related to the cyber incident itself in terms of the investigation, we're going to leverage that. So we don't have to rely on one specific area, but can work that out to the broader team if necessary.
Theodore, before I go to this side, Theodore, very, very quick question for you. From your perspective at this point, resourcing your technical team adequately, do you feel that there are any additional items that you would take, any additional budgets that you would open up at this point? How would you engage with your third-party solutions providers? Anything that you would do different in this situation as we try to contain the situation?
Well, I mean, you'd have your bridge open, you have your key resources on the call. I mean, you would have practiced and you would have been ready for something coming down, along these lines. You can always, and you should have the ability to supplement if you need to with subject matter experts if required. You would also be gathering intel from third parties, from the CrowdStrike looking in, the user behavior analytics and other types of systems that are looking in on the infrastructure. So, it's all hands on deck, basically. Yeah.
Please, yeah.
One of the IR capabilities, for example, is what my concern is in case within our regional SOC, I think about 17 hospitals using the same retainer. And my concern is if all of us to pull in that the same retainer, A, the hours will be gone in no time, and B, like, the experts, I don't think those companies are able to support us, like, 4 or 5 experts per hospital and bring in about 100 experts within that area. So that would be one of the concerns that we haven't ever even thought about addressing, actually.
Yeah, Ali, your perspective on that?
Exactly. What we said here is correct, because most of the hospitals that are on MSSPs, connecting to MSSPs, their monitoring, their SOC operation, all of that. If there is no basically even connectivity between them, and as our friend mentioned here, we don't have the needed resource from those MSSPs or incident responders that they can come into our environments and perform any type of investigation. That's one part. I think the biggest challenge we have in here, besides keeping the lights on concept, that how far we can go with the power generators, is the connectivity to the actual records that we have. Because we have centralized provincially, let's say here, all of the EHRs that are connected to all of the hospitals, basically, now they are all down. How are we going to basically maintain that? Even from the authentication perspective, they need to rely on the one network or whatever we have in place. So that's the key factor, that the business continuity plan is the key here. Even again, we have the power, we do have the 96 hours, but how are we accessing the records of the patients? Forget even about the hospital side, even home care delivery is not affected. And we know how many patients we have in our homes that they need to have care. And all of those care coordinators who are providing the care to them, they don't have access to the record. They don't know which patient needs what type of care. So those are the areas that also, again, this EHR connectivity is the key factor here.
I think you and Rhonda have brought up that this will start to cost quite a bit, and for those who are watching online, we do have a national economic impact counter that's showing us that we're about 6 hours into this situation, and the cost of this attack will only escalate. Ian, based on what Ali just told us, some of our partners in the healthcare and emergency services, like pharmacies for that matter, how those impacted, and how do you see the distribution for the dispensing of medications being impacted in this situation? How can the pain be limited?
It's going to be very difficult. If you think about the typical pharmacy, it's a small business, right? Or it's perhaps part of a large chain. If you want to look at, say, a Shoppers Drug Mart or something like that, most of those sites are not going to be power resilient. Their systems are going to go out. And so it's just going to be impossible to actually really know what kind of drugs you're going to be dispensing. Everything during that kind of event falls back to like a code gray process, right? Paper-based process. But getting distribution of drugs is going to be really hard. One of the other ones I was thinking of, like TIRDOS, organizations responsible for long-term care homes. The cyber side of it, whatever. But like, what about food? Food's going to start to spoil real quick, right? And you've got a very vulnerable population that you're going to have to feed, right? So going back to what Martin pointed out in terms of key contracts with suppliers and stuff like that, prioritization and getting something in place, like everyone's going to want diesel immediately. How do we make sure that healthcare organizations are prioritized? And then things like food and non-perishables, how do we make sure that we can build supply chains during emergency events for the really vulnerable parts of the population? I think that's really important.
Okay. Rhonda, I'll come to you for a very quick closing comment, and then both my co-hosts will just provide some key action items and takeaways. Rhonda, from your vantage point at this point, do you feel that the municipal space is adequately prepared for this environment, or what do you think is going to be the one major pain point you're going to face should we go into more hours of this outage?
So we do a lot of preparing. I mean, there's always more that can be done. To build on to the last point, there's a lot of pre-planning on that supply chain. So making sure that those discussions happen in advance so that there is a queue to get some of these key resources that are required. But if you ask me, my biggest, the biggest pain point will be the resourcing, will be people that are acting and helping out and trying to keep people from burning out, and swapping over the those coming in to help out in the event of a crisis. So that's always what worries me, is how do you keep people energized? How do you ensure that people know that their families are safe or their loved ones are safe so that they can operate effectively? And how do you keep that side working and keep people working at a very high pace? So that's some of the concerns that I would be thinking about.
There's a major human element to all of this. So very quickly, I'll start, Greg, to you. We try to close each session and put together some key takeaways. For you, what would be the top 2 takeaways that you think our audience needs to pay attention to, given the breach we're dealing with?
Yeah, absolutely. I think number one, as we've seen events proceed, it's most likely a nation state or something of that scale at that point. We witnessed it during the pandemic. Anyone who wants to bring pain to a group of people or a country or an organization, after targeting the grid, next up is healthcare, right? So I think, as a cyber group in health, assume breach, assume there's some gremlins there. With power coming back up, it doesn't mean that this is over. It could just be the start of a broader attack, right? So anything that could be done to prepare for that from a cyber perspective in terms of gathering intelligence, threat hunting, working together as well. It was framed quite accurately that there would be very limited resources in an event like this. So the more that people can work together, the more you're pooling resources and still effectively moving the needle. So I think that's an important part of it, and just constant prioritization I think is going to be key.
Thank you. And Martin, in terms of from your perspective, I really do appreciate you also bringing attention to the equity of service. One thing we have not gone deeper into is very specifically within our Indigenous communities also that may be hit by this environment. But what are at least 2 very important takeaways you want to leave us with?
I think number one is just a current state assessment of what the status is of just power availability across the healthcare facilities. That somehow needs to be centralized and coordinated so that if a disruption like this happens, exactly what the draw time is across the province. And 2, messaging. Like, again, we're 6 hours in and you have hundreds of healthcare organizations across the province. They need information because, again, they've already acted on the limited information that they already have. So to get clear messaging out from a centralized body would be very, very helpful.
Yeah, I think we downplay how important communications is to this whole environment. It's becoming abundantly clear, as Rhonda mentioned and as Lena mentioned as well, as situations could escalate not just to healthcare getting impacted or emergency services, policing as well, as folks may seek urgent attention and frustrations might rise. We're coming close to 6 hours into this breach, and we'll be back in about 15 minutes to look at the impact on our telecommunications sector. I want to thank you for joining us and thank the leaders at the table for giving us some critical steps to follow. See you shortly.